a lot of things can happen in the mouth that if you don't really go see a dentist, it would get to a critical stage where nothing can be done about it, then the tooth has to be taken out. And the mouth is the gateway to the human body. That's what I believe. And the mouth is structured in such a way that what we put into our mouth also affects our body. Would you be surprised that some diseases like HIV/AIDS can be detected in the mouth even before you actually start to experience the terminal symptoms? So the mouth, as I said, is the gateway, and we need to pay much attention to your mouth, because your mouth or your smile can actually boost your confidence. Your smile can also affect you generally in terms of certain heart conditions. Even gum disease can cause certain heart conditions. It can also cause diseases or aggravate diseases like diabetes and all that. So I think we should really focus more on the oral health as well.
All right, welcome back, Wellness Ninjas, to another episode of the Wellness Dojo Podcast. I'm your host, Kyle Craik, and now typically people aren't excited to sit down with their dentist, but Dr. Michael, I'm excited to have you here today. Welcome to the show, Michael.
Thank you. I'm very thrilled to be here today too.
So I'm curious, let's jump right into it. Why do dentists get such a bad rap?
I mean, it's everywhere. Globally, when it comes to cartoons, animations, they kind of exaggerate experiences at the dentist. They make it seem as if the dentist is holding a plier, a hammer, and they're going to use it to drill your tooth and take your tooth out. So growing up, lots of people get scared of this narrative, and when they become adults, it's a bit difficult for them to bring themselves to go to see a dentist.
Yeah. I can speak from my own personal experience. As a kid, I had really good teeth for the most part. Every time I went to the dentist, they were like very minimal cavities and stuff. My sister used to get so mad because I always had good experiences with the dentist. But then I wasn't taking care of my teeth for a while. And then I remember as an adult going back to the dentist, and the experience was so awful. My gums hurt so bad and stuff. And I was immediately labeled. I'm I hate going to the dentist. I hate it so much. But then now as an adult, I am taking good care of my teeth. And my experiences with the dentist are typically so much more enjoyable.
That's good.
Right?
That's good. I'm happy to hear that.
Yeah, but it's true. They do get such a bad rap, right? And I even see it with my kids. I've got 3 kids, and
nice.
I think my daughter would be okay with me sharing it, but she's recently had to get braces. Ooh. And so immediately when we go into, she had to do surgery and stuff like that, and immediately she just has this really poor attitude going in to see anything tooth related. But I'm curious for you, what's been your experience with that in terms of managing, because you do such a good job of making it fun. I think. Yeah. How have you kind of created that shift to make it a little bit lighter?
Great. So coming from an African background, from Ghana, back in Ghana, an average Ghanaian would only visit a dentist only when he or she had pain. So it was more of symptoms kind of treatment. So the preventative care wasn't really there. So people would go see the dentist, have their tooth pulled. They don't follow the instructions. Then they come back saying, "Oh, I went to take out my tooth and I ended up having a swollen head and all that." So back in 2019, what I decided to do was to start a whole social media oral awareness campaign. So try to use funny videos via TikTok, Instagram, try to make dentistry a little bit fun for the average guy. And I feel that in a way I've been able to have a bit of, let's say, a 60% transition of people now seeing the dentist as your friend, and they want to go have their teeth checked, their teeth cleaned, and it's been quite successful, I'd say.
Yeah. Well, and when you can create more of a more positive culture around it,
right,
then everybody benefits, right?
Yeah.
Like you said, because then they do go in, they have less pain. It's a more positive experience.
Exactly.
Is that something that you've really recognized? Is it a lack of knowledge, or is it a lack of resources, or both?
I would say that first of all, yes, there's a lack of knowledge because there's a misconception about dentistry. And I would also say that in terms of access, both geographic access and financial access, because looking at the ratio of dentists to the population in Ghana, it's a very wide margin. That's in terms of geographically accessing a dental clinic. And in terms of finances too, I would say dentistry is a bit expensive, but not as expensive as it is in Canada. But in Ghana, the average Ghanaian, how much they earn, they don't have much to go see a dentist to have routine cleaning and extraction or even having a routine filling done. So I would say in terms of geographic access and financial access, there's a bit of a gap that we're trying to bridge.
Yeah. And you mentioned like preventative care. Is that something that you recognized was really in need as well? Like things like even just flossing and brushing your teeth and like creating that routine and awareness around it?
Yeah, I would say that the awareness in terms of that, people don't even know from the layman wouldn't even know what a dental floss is from my country, Ghana. I remember I did one street interview a few years back, and then I usually ask like the people I'm interviewing that, what do you think this is? They look at it, looks like a toothpick. And I ask them, what's this used for? They go like, I really don't know. So I realized that the awareness is really low. So I tend to do some of these YouTube videos, straight interviews, for people to know that, so there's actually a part of Ghana where people don't really know about this, or even people watching the video go like, I really didn't know this, like this person also saying that he or she doesn't know about this dental floss. So I think it's mainly the awareness.
Yeah. And is that where the Smiles Foundation came in? Because
Yes.
I know you've created this amazing foundation to create that awareness and support. Is that where that all started?
Exactly. So the Awua-Mensah Smiles Foundation, I founded last year, August, on the 6th of August. And the main aim was to try and make oral health awareness more accessible to my audience, that's the Ghanaian population, even globally. I'm looking at the global scene too as well. So make it more accessible, the knowledge people should know when to brush, how to use the dental floss. There should be common knowledge. It's not something that should be too difficult for somebody to access. So we have a keen interest on kids. So we go to schools, we go to institutions, we screen them, we give them oral care products, and we try to educate them on good oral care practices. And that's something that I'm also trying to work on or do here in Canada, trying to make it more accessible to the First Nations, the indigenous people, because I did a bit of research and I realized that when it comes to certain things, they don't really favor them. And it's something that I've taken upon myself to also try and change that narrative here in Canada.
Yeah. So amazing. Yeah. And how long have you been in Canada for now?
I would say I've been in Canada for about 3 months now.
Yeah, 3 months. Yeah. And what's that journey been like for you coming to Canada?
My man, the cultural shock. Yeah, the cultural shock. But what I like about Canada is the people. The people are very welcoming. The weather, a bit challenging, but I like the people. I like the way the system is built. The system works, and I think it's a beautiful country.
Yeah. I've born and raised in Canada, born and raised in Calgary.
Nice.
Pretty sheltered.
Yeah.
But I'll just say welcome.
Thank you. Appreciate it. In my country, we would say Akwaba.
Akwaba. Okay.
Yeah, that means welcome.
Amazing. Well, I love it. I want to talk a little bit about dental hygiene because it's not something that we talk about a lot. And I'm curious first, like, why do you think that is? Why do you think this isn't something that we talk about in terms of, we talk about physical health and like exercise and working out and stuff, but dental hygiene has a really big impact on your overall health, your body, disease. Why do you think that's something that people just haven't talked that much about?
Great question. So I feel that people have certain obligations. They'll rather go check maybe a rash on their skin. Maybe they have a bone fracture in the leg. they see that to be more pressing as compared to the mouth. A lot of things can happen in the mouth that if you don't really go see a dentist, it would get to a critical stage where nothing can be done about it, then the tooth has to be taken out. And the mouth is the gateway to the human body. That's what I believe. And the mouth is structured in such a way that what we put into our mouth also affects our body. Would you be surprised that some diseases like HIV/AIDS can be detected in the mouth even before you actually start to experience the terminal symptoms? So the mouth, as I said, is the gateway, and we need to pay much attention to your mouth, because your mouth or your smile can actually boost your confidence. Your smile can also affect you generally in terms of certain heart conditions. Even gum disease can cause certain heart conditions. It can also cause diseases or aggravate diseases like diabetes and all that. So I think we should really focus more on the oral health as well. Aside the fact that we are checking other parts of our body to make sure that we're doing our blood work and all that, you should also have your mouth checked.
Yeah. It always goes back to the body is a holistic thing.
Yes,
there's not one part of it I think that we can kind of leave off the list. But I agree. I think the mouth is so overlooked and so vital in terms of just maintenance and making sure you take care of it.
Exactly.
And teeth and gums, and it's it is a job. It does take time. It does take effort to build that consistency for even the simplest things like flossing. How many people listening right now are like, I know I've been told I should floss, at least once a day or something like that, but they haven't done it in weeks. Right? It's not as easy as we think. It is. It's simple, but not easy.
Not easy. Let me tell you one experience from one of my patients in Ghana. This gentleman came to the clinic and we were talking about brushing, flossing and all that, and I asked him about his brushing techniques and all that, and he was of the firm view that yes, he's supposed to use a hard bristle toothbrush because he feels that's what's going to clean his teeth very well. And one thing he also told me was that he brushes till he sees blood, that's where he knows that he's brushing well. And I told him that it's not normal to see blood or your gums to bleed. It's a sign of gum disease. We're like, no, doc, I brush my teeth till I see that it's bleeding, that I know that my teeth are looking really good. And I knew that no, this misconception has to change. First of all, we need to let them know that you're supposed to use a soft brush, and also bleeding gums is not normal.
He's like, if I scrape away all the gums, then all the disease will go away too. Oh, that's brutal. That would be such an awful relationship that you would have to brushing your teeth too, right? And even trying to change that narrative that the hard brush is wrong for your teeth, it's really difficult because most of them have grown up using a hard bristle toothbrush, and these brushes are available in the markets in Ghana, and people are still using them. So let's talk a little bit about proper hygiene then. What are some of the big things that people should be? First of all, what are the warning signs? What are things that people should be looking out for in terms of if their mouth hygiene or health is not good? What are some signs?
So the first sign that is quite common, I would say, is bleeding gums. Because once your gums start to bleed, there's a high chance that you have gum disease. And gum disease, in its advanced stages, we call it periodontal disease. And it's a very silent disease. You don't have any severe pain, you don't have any problem till it gets to a latter stage where the tooth starts to become mobile, starts to become weak, and inadvertently it comes out, or you end up having to take it out. So first, I'll take bleeding gums. I would also say that one symptom that people should be careful of would also be pain. Yes, you don't just feel a bit of pain or sensitivity and say it's normal. No, sensitivity is not normal. Long lingering pain is also not normal. So such instances, you should still go see your dentist about it.
Sensitivities, that type of stuff, don't ignore it.
And even when you notice, for lack of better words, let's say you see a little bump in your mouth, whether it be in the inner cheek, underneath the tongue, or even on top of the tongue. But even with the bumps, getting to the back of your throat, you see some little bumps there. Those are normal. But if there's any sore in your mouth and you realize that within after 2 weeks, the sore is still there, you need to go see your dentist for them to check to see that it's not a cancer-causing bump or a cancer-causing ulcer or sore in your mouth. Yeah, it's really important because most people, in case you're smoking and drinking at the same time, you increase your chances of oral cancer. So once you notice any sore whatsoever in your mouth that doesn't heal beyond 2 weeks, you need to go see your dentist. So it's checked. Yeah,
that's a good point with 2 weeks, because there's common things that will pop up like canker sores and like that kind of stuff, right? And those things will pass over time.
Yes.
So how, like, that's a pretty common thing then, hey? Like just like oral cancer?
Yeah, oral cancer, because if there's constant use of tobacco and even drinking at the same time, these are predisposing factors that can actually predispose you to oral cancer.
Yeah, and we do live in a society now where we are putting ourselves in a higher risk for a lot of decay and problems in the mouth. Right? When we look at our dietary habits, especially in the Western hemisphere, right? And it's like the refined sugars, the alcohol, smoking, all this stuff. It's not good for our mouth.
It's not good. Too much sugar is bad for your health. As an adult, you're limited to the amount of teaspoons of sugar. I think for adults, you're limited to 6 teaspoons of sugar a day. For kids, you're limited to 3 teaspoons of sugar. So whether it be added sugar or sugar in drinks, that's a limit that you should try and look out for. Yeah.
Which sounds like asinine to probably most people. They're like, 3 teaspoons, like really, like there's that much there's like triple that in the cereal that they eat in the morning. It's crazy. What are some of the other things that we should like limit in terms of taking care of our mouth from a dietary standpoint? Are there any big ones?
Yeah, so from a dietary standpoint, as you mentioned, sugar is something that we all, as dietists, we all tell people to limit. It's very hard to say avoid it, but limit. The second will be tobacco, tobacco cessation. It's a bit difficult, but as I mentioned, tobacco is one of the predisposing factors to oral cancer. In our part of the world, I don't know if it's common here, but in our part of the world, people choose something we call betel nut. That can also predispose you to oral cancer. Cigarette smoking and alcohol can also predispose you to oral cancer. But in spite of that, something that I really admire that's being done here in Alberta, Calgary, is the fact that they put fluoride in water. I think quite recently, I think that's a part of June, the government now reintroduced fluoride back into the water, and it's a massive game changer. Fluoride plays an important role when it comes to your oral hygiene, especially for kids when their teeth are now forming and they are ingesting or taking controlled amounts of fluoride in water. It helps you reduce the chances of tooth decay because it's going to strengthen the teeth and it's going to make the teeth much more resistant to the bugs that actually cause decay in our mouth.
So can you explain like what exactly is fluoride and how it helps?
Right. So fluoride is a naturally occurring mineral that is put in toothpaste and also in certain water resources, and it's even found, trace amounts are found in certain foods like fish and all that. You see traces of. But what is put in toothpaste is different from the amount put in water. The amount put in toothpaste is designed in a way that you're not going to swallow it. So once you brush your teeth, you know you're going to spit it out. And even the ones put in toothpaste, there's an amount for kids and there's an amount for adults. I think for adults, it's 1,450 parts per mil that is put in the toothpaste. And that's enough to protect your teeth from decay. But for kids, they limit it to around 400, 500 parts per mil because with kids, because they've not really mastered the art of not swallowing, it's limited in the way that in case they swallow it, it's not going to give them any stomach problems or it's not going to cause a dental condition we call dental fluorosis, where the teeth become a bit discolored or you end up having this whitish flecks on the adult teeth. So they put an amount that's not going to cause that. So that is what fluoride is. And the one that is put in water, it's a very small amount. That's about 1 part per mil, very, very little, that you drink it and it's going to protect, it gets into your bloodstream and it helps when your teeth are actually forming and protects your teeth from from decay.
Interesting.
Yeah.
So does it help build stronger teeth, or does it just put like a protective layer over the teeth?
So it replaces one particular mineral in your teeth to produce a much more resistant tooth to acid. That's what it does. And even for kids, when they have their baby teeth in their mouth and their adult teeth are now forming, they using fluoride to brush their teeth, or they drinking water that contains a bit of fluoride, it helps the adult teeth that's being formed to become even much more resistant before it appears in the mouth. So they have that added benefits.
Yeah. Awesome. Yeah. I think it's really important, because these are the types of conversations that I think aren't being had. We just know, right? That's kind of where the education stops. So I really appreciate you breaking that down, because I think there's a lot of people who don't know the difference, like myself, right? And now I do.
Yeah, that's true.
So fluoride is one thing that can be really beneficial for the teeth in terms of how people can, on a daily basis, other than brushing, flossing, and creating that routine, dietary things. Like what are other things that can really help protect your teeth or your gums and your overall health?
So I would say that fruits and vegetables also play an important role. You need something crunchy, so you limit yourself from taking these processed meals, because taking fruit, you're having your vitamin C that helps with the cells in your mouth. You're taking calcium, really good. You're taking magnesium. All these can be found in vegetables and fruits, but with the Western world, people like processed foods, things that have already been processed, and they'll put a nice label on it, contains vitamin C. No, you need the real fruit itself, because even chewing also helps with the development of the jaws when it comes to kids. In my part, from Africa, West Africa, Ghana, people like to even chew bone. Yes, it's very common. They finish like chewing, taking the flesh off the bone, they tend to chew the bone. So most people in Africa really got strong jaws. So when you're trying to pull a tooth out, trust me, you'll suffer. Because I remember I had a couple of expats coming to the clinic. Some, I would say, Chinese people from the States and all that. Taking out their teeth wasn't difficult, but for a locally grown man or woman, sheesh, they've got strong jaws. Because growing up, after they are done eating, they chew a lot of bones. They take a lot of vegetables, and also they have well-formed jaws. Yeah, and it's actually pretty good if you got really good teeth and bones. It's good. Yeah,
I was gonna say, because that jaw strength is an indicator of being healthy.
Yeah, it is. Right? It is.
Yeah, and you're right. Like the processed, like our mouths just do not have to work as hard to eat nowadays. Yeah. Even when like a lot of people eat, chicken or a steak or something like that. Now it's all deboned. Like you're not ripping stuff off the bone. Like we are mammals. Like
everything's minced.
We were intended to like use our mouth to rip stuff off, and like even I can almost recognize that like my teeth are weaker as I've gotten to be an adult, which probably is normal as you age a little bit, but probably a lot of that does come from the fact that you grab a burger, you don't have to work very hard to chew that burger up, right? But like a good rib or something like that, you're ripping that, like you do notice it.
I agree. I agree with you.
Yeah, so it's important to exercise that jaw. Well, that's good, and it also speaks to the value of eating whole foods. Right. Because it sounds like not only is it going to benefit your overall health, but it's going to benefit. Just like you almost have to exercise your teeth. You
don't exercise your teeth at all, because it's all drinks, energy drinks, and all that. It's really gonna affect you in the long run. And you mentioned drinks too. I'm also really curious. I'm a coffee lover. Like I love drinking coffee. I drink probably. I always try and dial it back, not to drink too much, because I get the jitters sometimes, and I notice as I'm getting older, it affects my sleep more. What kind of impact does coffee and caffeine have on oral health? Great question. So, coffee is quite good. The only side effects I would say is maybe the potential for it to discolor the teeth, but there are ways around it. I usually tell my patients back in Ghana that if you're going to drink coffee, try not to sip on it for too long, because the more your teeth is exposed to the tannins in the coffee beans, what's going to happen is that it's going to leave certain discolorations around the teeth. So it's important that you don't sip on it for too long. If you're going to drink your coffee, 10-15 minutes top, you should be done with it. But don't constantly be exposing your teeth to the coffee, because with coffee too, you've got sugar and all that. Don't be exposing your teeth to sugar over a long period of time. And as I said, if it even gets discolored, you can go see your dentist and have a routine cleaning done. And one thing I even tell my patients back in Ghana is that when you're done drinking coffee, get a cup of water, swish your mouth and swallow, so that if there are any remnants of the coffee stains, you just swish your mouth with that. And don't brush your teeth immediately after having something like coffee or any food. You need to allow your teeth, there's something called an aesthetic challenge. After you're done eating, you need to wait for 30 minutes before you attempt to even use a brush to brush your teeth.
Interesting.
Yeah, that's something that a lot of people don't know.
Yeah, I didn't know that.
Yeah.
So wait 30 minutes.
Wait for 30 minutes, because once you're done eating something like that or drinking something like that, your teeth, the saliva in your mouth needs to push back the ions that left your teeth in the process of eating. And that process takes about 30 minutes. So you wait for that process to naturally happen. If you go ahead to use a brush, it's like brushing acids all over your teeth. And that's going to worsen the structure of your teeth.
Yeah.
Yeah. So allow your saliva to push back the ions back into your teeth. And even if maybe you're worried about bad breath or something, you can decide to chew gum, because the chewing of gum stimulates your salivary glands to produce saliva. And the sugarless gums also contain what we call xylitol. And xylitol has a protective effect by reducing the activities of the bugs in your mouth.
Interesting.
The bad bugs, yeah.
See, because I was always taught growing up that like gum is bad for your teeth.
But sugarless gum is good.
Is the key.
Sugarless gum,
yeah.
Sugarless gum.
Okay.
Yeah.
Interesting. So with coffee as well, drinking from a straw, is that beneficial? Because that's one thing that I've heard as well.
Yeah. That's also another way around it, because using a straw, you get the fluid directly into your throat. And it's quite common that some people, aside coffee, some people also tend to drink lemon water in the morning, because they feel like it cleanses the system. And what I've noticed is that patients who come to a clinic who drink a lot of lemon water in the morning, they tend to have what we call erosion of their teeth. The acid from the lemon wears off the teeth gradually. It's very common. So what I even advise for people who take lemon juice or coffee in the morning, you could also use a straw, because it goes directly into your throat.
Yeah. Very interesting.
Yeah.
It's good. I like these little life hacks.
Yeah.
This is all beneficial because we're up against it. We're living in a society that, we all make our own choices and we all like take responsibility for our own actions and stuff like that. But we are kind of predisposed to almost the privilege of the society that we live in here and the accessibility of processed, high sugar, just fast-paced living, puts us at a bit of a disadvantage almost.
It does. It does. It really does.
But it's like prioritize. I think it always comes back to the same things for me, whether we're talking about mental health, physical health, oral health. It's like prioritize taking care of your body, like whole foods, holistic choices.
Yeah.
Are there any, just with that coming into my mind, are there any connections that you know of with oral health and mental health?
That's a pretty good question. So, I'm an ambassador for the World Oral Health Day, that's by the World Dental Congress, FDI. I've been doing this for the past 4 to 5 years now. And last year, our theme for World Oral Health Day, which is held on the 20th of March every single year, was a happy mouth is a happy mind. So what we were trying to do is that we were trying to get the link between oral health and then mental health. And you'll be surprised that there's a lot, like both of them are interconnected. So I remember I did a podcast with a psychologist, and I was marveled about some of the relationship between the two. So yes, there is indeed a relation between the oral health and then the mouth. In terms of, let me give you a condition. There's this condition called bulimia. So these people taking foods, it's a mental condition. They take in foods and they forcefully bring out the food because they want to maintain a certain form or shape. Yes. And such conditions, you can also detect it at the dental clinic. You realize that behind the upper teeth, because the person is throwing up, a lot of the acid content from the stomach erode the lingual or the back sides of the teeth. And it's over a period of time, you wear off your teeth and you're now predisposed to sensitivity. And it's one thing that is interlinked. So it's either you're trying to advise the patients about the oral health in order to solve the bulimia, or bulimia also interlinked to trying to solve oral health. There are so many links or connections between these two.
Yeah. Wow. Yeah, and it's you can see how it's very evident that the mouth becomes a key to that, right?
Yes,
because there's different ways I imagine that you could approach that, where it's like, if we want to fix the issue that's going on in the mouth, we need to fix this mental condition, but also if we can help this mental condition, it's going to help the health of the mouth. It's like a back and forth.
And there's even been studies that they've been even able to link some of the bad bacteria in the mouth that can later on bring about Parkinson's and all these mental health conditions. So it's really important.
Any connection with like anxiety, depression, anything like that as well?
Great question. So there is a connection between anxiety and depression. Somebody who is anxious or depressed now doesn't take very good care of the teeth, is not eating properly, is just feeding on sugars every single day, and that's going to cause tooth decay and gum disease. And somebody with tooth decay, gum disease, you're anxious, you're depressed, maybe you're not, for lack of better words, you don't really care much, and this situation keeps worsening and worsening till a point where you end up having to take out the tooth. So these are interlinked. So the dentist actually needs the psychologist as well in order to work. We can't work in isolation and feel we can solve all that. No, there's an aspect of mental health to it. We are treating, as you said, a holistic approach. We are treating your teeth all right, but we noticed that no, you've not really brushed in a long while, there's gum disease, and we try to involve the psychologist as well, that okay, we're done with your mouth, but I would want you to see this person. You also take it up from there. Or even if the psychologist is treating a case like that and realizes that there's bad oral hygiene, they also try to involve us. So as you said, it's a holistic approach to it.
Do you believe that we have a long way still to go in terms of creating that holistic connection within our system?
Yeah, we have a long way to go. We have a long way to go. But with initiatives like the World Oral Health Day that's celebrated every year on the 20th of March, I believe we're able to create a lot of awareness when it comes to World Oral Health Day. And I ever remember the time where we even had a song, a dance to this whole theme. A happy mouth is a happy mind. There was a song actually by the World Oral Health, the World Dental Congress, where they got people to start a dance challenge, to dance to it, just to make it fun and create the awareness for people to know that wow, a happy mouth is indeed a happy mind. So how can I make, the next question is, how can I make my mouth happy in order to get a happy mind?
I love it.
And that's where we take it up from there.
What a fun initiative, and a very important one too. Right?
The FDI World Dental Congress is doing amazing when it comes to this. And next year, there's going to be a different theme. It goes on. So this year's theme was a happy mouth is a happy mind. Next year, we're going to have a different theme. So it will be a happy mouth is, and then we add something else to it.
Amazing. Well, you're doing amazing work, man.
Thank you very much.
I'm really curious too, like, what made you want to get into this line of work? Like, what drew you to that?
Wow. So I'd say growing up, I always wanted to be a mechanic. I don't know. I loved how gears and all that worked. So growing up, I remember one time I got my dad to take me to go shadow this mechanical engineer back in Ghana. And I think it was a BMW showroom, and there was a mechanic shop there, and I got to learn how the car works, how they name their cars and all that. 523i means 5 Series 2.3 liters. I was like, whoa, if I didn't come here, I already know this. So I was really intrigued about mechanical engineering. But when I got to senior high school, I offered science, and I did a lot. I think amongst the three main subjects, that was physics, chemistry, and biology, I fell in love with biology because it was more easy to understand, and you can relate it to yourself and all that. And I now decided that, you know what, I need to find a balance between becoming a mechanical engineer and then biology. And I was like, okay, I thought of dentistry. I was like, in dentistry, yes, there's a biology point, and there's also a mechanical engineering point where you're holding tools and things that look like spanners and all, trying to fix things in the mouth. I was like, let me try and shadow a couple of dentists in Ghana. So I shadowed a couple of dentists, and I realized that dentistry was really cool. What I loved about it was the work-life balance. You're not on call 7 days a week as compared to our medical counterparts. You get the work-life balance, and you also get to put a smile on people's faces. That's why I decided to get into this line of work.
I love it. Well, we're really glad that you did, because you're, like I said, you're changing the narrative. I can see that you're creating a positive shift towards dental hygiene and dental health, which is just so important, right? And you're still loving it, I'm assuming.
I'm still loving it. So I'm trying as much as possible to get my dental license to practice here in Canada, so that in the future I can be working here, also still be working in Ghana. That's so cool. And it's got to be, I imagine, challenging being in Canada now, and you've still got the nonprofit that's running in Ghana as well. Can you talk about that a little bit? Is it challenging? It is challenging. So with my nonprofit, every Sunday we have a general meeting via Zoom, trying to plan outreaches every quarter. So we try to aim for about 2 to 3 outreaches every quarter, just to try and make Ghana a better place when it comes to oral care. So doing that, also trying to prepare to write some exams here in Canada to get licensed to practice as a dentist. It's not really easy.
You're a busy dude. I can see that. I'm curious, like, what are some of the major differences? We've talked about some of them, but what are some of the major differences between dentistry or even just dental hygiene here in Canada, North America, compared to other parts of the world?
Right. So the difference, I would say, first, in terms of geographic access, there are so many dental clinics here in Calgary. Every street corner, I see a dental clinic. And I feel some years back, Ghana was not like that. And we are almost there. You tend to see a lot of dental clinics springing up. But back then, it's just the public dental clinics or some few private clinics around. But that thing is starting to change. We are having a lot of dental clinics springing up. And also the fact that with preventative care, it's more rampant here in Calgary, in Canada, I mean. The fact that it's, even if you as an individual, you don't have the funds to go see a dentist, the government of Canada has the Canadian dental plan in place for people. For instance, people who are low income, and you're able to prove that you're low income by submitting your tax returns for the previous year, you qualify to actually get that plan and have access to seeing a dentist, which I feel is amazing. Back in Ghana, yes, we have a government-funded health insurance, but this health insurance cannot really cater for most of the dental care. It may cover a bit of consultation or just consultation, and you have to top up. But most people in Ghana who don't have the resources or the finances to top up, you now leave them out. And their condition keeps worsening. So that would be something that I'll say we are struggling a bit with in Ghana. But I'm hoping that certain policies can be made by the government of Ghana to try and change that and make oral health care really, really accessible to people.
Yeah.
Yeah.
I love that.
Yeah.
Well, like I said, doing incredible work. I'm going to change direction just a little bit here. I have a question.
Right.
My previous guest left this question for you.
Oh.
They didn't know it was going to be you, but it's something I do. I'll get every guest gets to leave a question for the next guest.
Yeah.
So are you open to me asking you this
I'm
question?
open to that.
All right. Let's see what it says. Okay. I haven't read it before, so. Who are you with, and where are you when you feel most loved?
Who am I with?
Who are you with, and where are you when you feel the most loved?
That's a pretty tough question. Who am I with? I would say for now, I'm single. I'm not with anyone now. And where am I? And what makes me feel most loved? So I'm at the state where I feel that I want to attract love, in the sense that I'm trying to build myself, get to a certain point where love naturally finds me, and where there's not a constant power struggle, trying to battle it out when it comes to like trying to build something together with someone. So I feel that that's where I've gotten to at this point. And what makes me feel truly loved, I would say my love language would be acts of service. Yeah, acts of service. The fact that you have a deep thought that, maybe I feel this could make this person happy, or maybe I can render this service or do something for someone. I feel that's actually what makes me feel really loved.
Yeah.
Yeah.
How would you define love?
Love. Love is a very big word. Love, I would say that the ultimate love would, I don't want to go too religious, but the ultimate love would be the love that your supreme being has for you. Yeah, because in terms of our flaws and all that, God is able to forgive us and not cast us into certain situations and say, because you did A, B, C, D, you're going to die, you're going to do this. But for him to send his son, Jesus Christ, to come and die for our sins, I think that's the ultimate love. Yeah.
Yeah, I like that. I like that. And so with that, that's a really like deep and powerful question, right?
Yeah.
It's like, where do I feel the most love? And it sounds like you maybe within your faith is where you feel that. Yeah,
because for human beings, we may say that we love someone, but deep down, it's unconditioned. Maybe you may meet a man, for example, a lady may meet a man, telling the guy that, she loves the guy, but it's on condition that he can provide. Once the provision is not coming, the love kind of simmers down. Love is a fleeting emotion when it comes to human beings. So I believe that, yes, you can decide to love someone, but have it in the back of your mind that it's a fleeting emotion. Yeah.
It's so true. And I think in today's world, it's put the emotion, the feeling of love is put so much like up on a pedestal.
Yeah.
I've often had conversations about this before, and I know this is far from the oral health and stuff, but but in a sense it's not, because it's all connected, right? Because love does kind of, when you're feeling love, when you're giving love, that feeling of love is interchangeable. I think when you're experiencing love in your life, wherever you're getting it from, whether it's from your faith, whether it's from a relationship, whether it's like from yourself, I think it does just create your overall better health.
It does.
You're gonna have better mental health. You're gonna feel better physically. You're probably going to be taking better care of yourself.
Better care of yourself,
right? even something as simple as brushing your teeth every single day, taking care of your oral health.
Yeah.
I mean, that's a form of self-love, taking care of yourself.
Yeah, it's a form of self-love. I agree. I agree with that.
Interesting. Well, I appreciate you answering that question.
Thank you.
That's a tough one. And for all the ladies out there, you heard it here, is single man. Are you currently seeking love?
Oh yeah, I'm currently seeking love.
Yeah.
I'm talking to people just to make sure that we are aligned.
Yeah.
It's
a tricky world out there.
It's a tricky world. Yeah. Very tricky.
Well, respect to you, man. Respect to you. Is there anything that we haven't talked about so far that is really important for you to talk about?
I would say we've covered always everything.
We've covered a lot.
We've covered a lot.
I really appreciate the conversation. You're doing such a good job. One other thing that I did want to talk to you about, you are creating amazing content around creating a new narrative, a positive approach to dentistry and to seeing your dentist and just learning more about it. But one of the ways that you do that in such a unique way is you do some really cool videos. You do some digital content as well. Do you want to talk about that just a little bit? Yeah,
that's true. So aside the fact that I work as a dental professional in Ghana, in Canada too, I do a lot of digital content creation. So I have a podcast with a very good friend of mine called Jade Kennedy. Shout out to Jade Kennedy. She's the owner of Tooth Express, which is a mobile dental van in Canada. So what we do is that we go to certain events. I think that the very first one I went to was Day One Dats. They had this event. That's how we eventually connected. And it was a very amazing initiative that they're actually doing. So what we do is that we go to such events, we take videos, we interact with people, we edit, and then we put it out to the general public. And what the initiative we're trying to do is that we're trying to create a Calgary or a Canada where brands are being promoted and people are getting to know that, there's a pickleball center here, there's this happening here, to make people involved and get them to participate in lots of activities. And for me as an individual, this is also of much advantage to me because I'm getting to know the people, I'm getting to network and getting to imbibe myself in the culture and all that. So that's one aspect, the podcast that Jade and I have. And I also create videos or interactive videos for brands. I worked with Fresh Roots, which is a mobile grocery store. I do a bit of volunteering services for them. Whenever they have markets, I go there, take videos, and then get people to be aligned with them. So I work with all brands. So anybody willing for me to work with their brand, create engaging videos for them, I'm willing to do that.
Yeah. I love it. And you do such a great job of it. Like, I follow you on Instagram and everything. I love your videos. You're really talented with that as well. So
thank you very much.
A man of many talents.
I really appreciate that.
Well, I really appreciate you being here on the show. It's, like I said, it's not something that I think we talk enough about. I don't think there is enough awareness, but there's people like you who are creating that awareness, which I think is so important because it's very overlooked and just such an important thing to take care of your mouth.
It is. It is.
Awesome.
Thank you so much for having me today. It's been an amazing experience and I'm happy to have shared the little knowledge that I have with everyone watching now.
Likewise. It's been fun. Thanks to you and thanks to everybody for listening and watching, and we'll see you in the next episode.